So you're planning to take the NCLEX for the first time, or for the first time since your last time. Where do you start? What's up? I'm Quite Mike, and here's my take on how I study to pass. This video will be similar to the video that I made about the materials I used, but this is just going to be about my study flow. But if you're interested in what I use to study, here's a link to the video. Or you can wait till the end of the video and the link will also be there too. Okay, so you finished and you graduated from nursing school. Or you took your NCLEX, failed, and need to start again. This video may be a little bit biased towards those of you who have failed because I too have failed. But here are my 3 tips in how to study for the NCLEX. Whether they're the questions or the content in the questions or both, or whether it's something that's completely out of review, or whether it's something that you're dealing with in life that bothers you in how you review, you need to acknowledge, you need to know, you need to be aware that you have a weakness. You need to address the elephant in the room. You gotta know it's there and you gotta deal with it, so that while you're reviewing for the NCLEX, if it's going to bother you, it's not going to bother you as much, as long as you manage it. SATA, or Select All That Apply questions, are very common on the NCLEX. Well, they can be. And a lot of us are a little nervous about taking the NCLEX just for that reason. Select All That Apply questions are just unavoidable sometimes. And you need to be able to know how to take those questions, how to answer those questions. Whether you answer them all correct, all wrong, or in the middle. I knew that it was a weakness for me, but I knew that as long as this was still practice, it was okay. I tried as much as possible not to avoid those questions, but instead embrace them. While I'm still not taking the actual exam, it's good practice for me to be able to take those questions. Take them one at a time. Read over the questions, read over the answers. Think about the concept, think about the disorder, think about the procedure, whatever the question is about. Select all that apply. One question at a time, one question at a time. It's better for me to freak out at the practice test and to be able to calm my nerves down and to get used to them than to see them for the first time on the actual exam, right? Don't freak out. Use your practice time wisely. Be aware of your weaknesses during your practice time. Because on game day, it shouldn't be a surprise that you're going to eventually see that weakness. Depending on what your weakness is, you may or may not encounter it. But it's the NCLEX. Anything could happen, right? A weakness not related to nursing was my heartbreak. While taking my exam for the second time, I was going through a heartbreak. I was thinking that my life would be easier if I could just pass this exam and forget all about the heartbreak. My mistake is that I should have dealt with the heartbreak way before I even took it my second time. I should have taken my time, relaxed, talked about it, prayed about it, be more self-aware about what was happening to me, why I was thinking certain things, to cast away all doubts, are we going to be back together or anything like that. These are obstacles, these are weaknesses that you need to address right then and there. Because when it comes down to it on NCLEX day, it's not going to look so pretty. So yeah, if your weakness is rather knowledge-based or maybe psychologically based, handle it before you take your NCLEX. And keep in mind that these things don't resolve, overnight, but they resolve over time. So if you're nervous about Select All That Apply, hotspot, or sequence questions, or something is bothering you, psychologically, something within the family, something between relationships, you should deal with that head on, or at least you should deal with it, acknowledge it, address it, manage it. Weaknesses can get the better of you, but it doesn't have to be that way. One of our big weaknesses when it comes to the NCLEX is that we don't know everything. But again, we're not supposed to know everything. So what do we do about it? You just have to stick to what you know and use your test-taking strategies. When you combine those two, even if you encounter a question that has content or is asking something of you that you don't know, you can use what you know and you can use your test-taking strategies to at least get a better idea of what the answer could be. You can still come up with the best answer that you can give, as opposed to just guessing out of thin air. So just know your weaknesses, know that they exist, and don't let them pulverize you on NCLEX day. Systems. Individual systems, cardio, renal, respite, they all affect the body. But how? As a nurse, you gotta use your clinical eye, right? You gotta look at your patient, you gotta see what's going on with them, see their signs and symptoms, And we went to school to be able to learn and to be able to understand what things happen in the human body, anatomy and physiology. Nursing subjects that clue you in on what kind of disorders or diseases this patient might have and what kind of signs and symptoms are associated with said disorder or condition or whatever. God made the body smart. It can protect itself and it can care for itself as much as it can. There's a lot of compensating mechanisms. So in the case of like metabolic acidosis, what is your body going to do about it? How is your body going to compensate? How about low blood pressure? How is your body going to compensate for that? The NCLEX is a test about safety. And I think one of the biggest things that you should emphasize when you review is what are the medical emergencies in each system. Yes, there are a lot of disorders and diseases and conditions that we are to know about, but the most important ones to know are the medical emergencies. When you're given a priority and delegation question, you should know which one of those diseases or conditions that the patient has is the most important. I think I'll pick the patient with the COPD with the shortness of breath. I get that you're trying to use ABC, but I think onset of chest pain is a lot more important. You gotta know your medical emergencies. So know those medical emergencies and familiarize yourself with the signs and symptoms that are indicative of those medical emergencies, or you may endanger your patient in real life. Get to know the human body, anatomy and physiology, one system at a time. So once you got to know your own personal weaknesses and you started reviewing by system, it's time to at least get started on comprehension. It's about a month or so right before your exam. It's time to see what you've learned. At this point, you should be fairly competent in taking your comprehensive tests. Now, when choosing the kind of questions that you should be answering, you should be doing the questions by random. You shouldn't be doing them according to system. So if you're using an app, you want to select random questions. You want to apply all the systems in your practice test as much as possible. If you're using a book full of questions, you should just be taking the comprehensive tests for that book. You may occasionally want to go back and forth between the systems that you're weak at, but now is the time for you to focus comprehensively. It's for you to look over everything, randomly. It's time for you to look back and go through everything comprehensively, all together. Like training for a marathon, you have to keep running each and every day. So by the time that you actually get to the marathon day, you can actually have the stamina and the endurance to keep running. After you've developed a routine to be able to run each and every day, you just gotta maintain it. So similar to that, when reviewing for the NCLEX, you should just continue to review. The hard part was developing a schedule and sticking to it, and being able to do questions and review each and every day. All you have to do at this point is just keep hanging in and keep doing your review, especially questions. Keep doing your questions. Show up each and every day to be training. Show up each and every day to be reviewing. And like me, hopefully you too can pass this way. Or at least have a better idea of how you can prepare yourself to pass the NCLEX. So in a quick review, know your weaknesses, get to familiarize yourself with the body, the human body, with anatomy and physiology, and test yourself comprehensively with everything that you've reviewed. See what you've learned by applying what you learned through questions. My testimony and my bullet journal logs about my study regimen is down in the description. Well, that's all I have to say for this video, so feel free to like, comment, and subscribe for more content. So with all that said, study well, rest best, and pray the most. Thanks for watching.